Just 2 minutes. Okay. So let's start. Today we are going to discuss the very important topic, that is amyloidosis. So before starting this topic, we have to first understand the definition of amyloid. What is amyloid? Basically, it is a misfolded protein. It is a misfolded protein that is going to deposit in the extracellular space. This is the definition of amyloid. And when this abnormal misfolded protein will go and deposit in the extracellular space, it will damage our tissue. So this is the normal basic definition of amyloidosis. First of all, you have to understand what is amyloid. Amyloid is a misfolded protein that deposits in the extracellular space. And when it is deposited in the extracellular space, it is going to damage the tissue. This is the normal definition of amyloid. Then you have to keep this thing in mind. These proteins, like in the amyloid, there is not one single protein. Multiple proteins can deposit as the amyloid, and these proteins, when go and deposit in our extracellular space, the configuration of these proteins is abnormal. It is in the form of beta plated sheet. So here they write, what is amyloidosis? It is the extracellular deposition of protein. And you have to keep this in mind. Misfolded these are the misfolded abnormal protein. These are not the normal proteins. And these abnormal proteins are in the form of fibrillar. So what is the meaning of fibrillar? Basically, it is the beta plated sheet configuration. It is a configuration in which the protein is going to be deposited. And when it deposits outside the cell or in the extracellular space, it will damage the cell. And when the cell is damaged, it will lead to apoptosis. It will lead to cell injury, and cell injury can lead to apoptosis. So this is the basic definition. Then second, we have to understand the manifestation of amyloidosis. The manifestation of amyloidosis depends on the organ. Let's suppose if these abnormal proteins are going to be deposited in the renal system or in the kidney, they will cause the nephrotic syndrome. But if they are going to deposit in the heart, in the cardiac system, they will lead to restrictive cardiomyopathy. And if they are going to in the intestine or in the gastrointestinal system, and in the gastrointestinal system, if they are going to deposit in the liver, they will lead to hepatomegaly. If in the spleen, they will lead to splenomegaly. And if both the organs are involved, it is called hepatosplenomegaly. And same like that, these proteins can also peripheral nerves, that can lead to peripheral neuropathy, and it is a kind of neurological problem. Then after that, these abnormal proteins can go and deposit in the tongue. It can lead to macroglossia. Macroglossia, basically, it is a enlarged tongue. It can lead to it can lead to muscular enlargement of the tongue, which is called macroglossia. Then also it can go and cause the carpal tunnel syndrome. In the carpal tunnel syndrome, basically it will damage the median nerve. So that is called carpal tunnel syndrome. Then after that, these abnormal proteins can go and deposit in your skin. There they present as a waxy thickening skin. And if they will go and deposit in your eyes, that will lead to eye bruising. So these are the clinical manifestations of amyloidosis. So just keep one thing in mind. These manifestation depends on the organ where the amyloid protein are deposited, and these manifestation varies from person to person. Like one person might have the problem of renal, one person might have the problem of GAT. Like it's not the clinical manifestations are always same in every patient, but they can ask from you in the exam, like what is the most common organ that is going to be involved in amyloidosis. That then after that, when these abnormal proteins, which we call the amyloid, are going to deposit in the extracellular space, we can see these proteins by using the Congo red stain, on which they will appear as red orange on a non-polarized light. So here you can see the diagram. They show the diagram of the abnormal proteins. And after that, you have to keep in mind these things you can also see under the under the microscope, under the polarized light, where they present as apple green birefringence. So just keep one thing in mind. These abnormal proteins can be visualized by different method. One method is using Congo red stain. Another method is under the polarized light. On the Congo red stain, they will appear as red orange. On the polarized light, they will appear as apple green birefringence. You can see here, these are the apple green birefringence. And after that, we can also see these proteins on hematoxylin and eosin stain, on which they appear as amorphous pink material. So these are the, you can say, different staining methods which are used to see the amyloid or abnormal proteins. Then after that, you have to keep one thing in mind: the amyloidosis is divided into two major categories. One is systemic and one is localized. So first of all, we have to understand what is the meaning of systemic and what is the meaning of localized. So let's suppose if these abnormal proteins are going to be deposited in only one organ, only one single organ, then it is called localized amyloidosis. But when these proteins are going to be deposited in multiple organs, it is called systemic. So please keep this in mind, the clear difference between the systemic and localized. Then after that, we have to study the systemic amyloidosis type. Systemic amyloidosis type is divided into two main categories: primary amyloidosis and the secondary amyloidosis. So first of all, we have to understand the primary amyloidosis. Then after that, we will see the secondary amyloidosis. So first of all, the in the primary amyloidosis, what are the abnormal proteins that are going to be accumulated in our body? These are the light chains. These are the immunoglobulin light chain, which are called AL. So basically, A mean amyloid and L mean light chain. These are the abnormal light chain proteins which are going to be deposited. So the question is, from where these abnormal proteins are coming? So basically, if a person has the plasma cell dyscrasia, it is a type of cancer. It is a type of plasma cell cancer, which is called multiple myeloma. Multiple myeloma is a disorder of blood. It is a cancer of plasma cell, which is also called plasma cell dyscrasia. So when there is a cancer of plasma cell, then those plasma cell are going to be produce more IgG light chain, and these IgG light chain are going to be deposited in our body in the extracellular space, so which is called primary amyloidosis. Then after that, we have the secondary amyloidosis. So again, we have to understand in the secondary amyloidosis what kind of protein are going to be deposited. In the primary, we see these are the immunoglobulin light chain, but in the secondary amyloidosis, there are not like Ig light chain. These are the serum amyloid proteins. So the question is again, from where this serum amyloid protein is coming? So this is the important question. So first of all, you have to keep this in mind. Their serum amyloid proteins are coming from the inflammation. So when in our body there is a chronic inflammation like rheumatoid arthritis, like inflammatory bowel disease, or familial Mediterranean fever, or protracted infection. So in these chronic infections in our body, there is going to be produced in large amount of serum amyloid, you can say SAA, serum amyloid protein, and this SAA will going to produce the double A amyloid. So please keep these things in mind. So if they ask question from you, from where the double A protein is coming, it is derived from the SAA, serum amyloid abnormal protein. And from where the serum amyloid A protein is coming, basically it is acute phase reactant. It is increased in the chronic inflammatory conditions like here the example of rheumatoid arthritis, inflammatory bowel disease, familial Mediterranean fever, then protracted infection. So these are the different examples in which body has underlying chronic inflammation, and in the chronic inflammation in our body there is going to produce acute phase reactant that is called SAA, and that acute phase reactant is going to produce the amyloid A. So you have to keep this in mind. So this is about the secondary amyloidosis. Then after that we have the transthyretin amyloidosis. So basically transthyretin is a protein. So here is the important thing, you have to keep this in mind. We have the two kind of these problems, like the transthyretin is muted or not muted. So first of all, you have to keep in mind there are two types of transthyretin. First one is the sporadic, and second one is the familial. So basically, transthyretin amyloidosis can occur in two conditions. One is sporadic and one is familial. In sporadic, basically, it is a slowly progressive condition that is associated with aging. Like when a person is going to be like 70 in 80, in our body, there is a production of one protein that is transthyretin. So as your age is increasing in your body, there is production of transthyretin, and that protein will go and damage your heart. So this type of amyloidosis is called sporadic, which is also called wild type. Wild type mean there is no kind of mutation in the transthyrein. But we have the familial. In the familial, again, we have the abnormal transthyrein. But the question here is, what is the difference between sporadic and familial? In sporadic, the transthyrein is non-muted. There is no mutation in this protein. But in the familial, there is a mutation. There is a mutation in the transthyrein protein, and that mutation is uh, going to produce the abnormal transthyrein, and that abnormal transthyrein is going to be deposited in our tissue. So just you have to keep this difference in your mind, like what is the difference between sporadic and hereditary. Sporadic mean sporadic or hereditary, they also call the hereditary familiar. So first of all, what is the meaning of sporadic? The meaning of sporadic is that it is not in your germ line, it is not in your germ cells. It's simply, you can say, in this there is abnormal protein which is called transthyrein, and that protein is going to produce with aging. As your age increase, the amount of this protein is going to be increased, and then after that this protein is going to be deposited in your extracellular space of the heart, where it can lead to damage of the heart. Then after that we have the hereditary, which is called muted transthyrein, and that will lead to familial amyloid polyneuropathy and cardiomyopathy. So it means when the condition is hereditary, this abnormal transthyrein protein is going to damage the nerves, which is called the multiple neurons or multiple nerves are going to be damaged, which is called polyneuropathy. And after that, these proteins are also going to damage the heart, which is called cardiomyopathy. So these are the, you can say, the differences between the sporadic type and hereditary type of transthyrein amyloidosis. The major difference between these types is, you just have to keep in mind, in the sporadic type of transthyrein amyloidosis, the transthyrein protein is not muted. But in the case of familial, you just have to keep in mind, in this type of transthyrein amyloidosis, the transthyrein protein is muted. So when the protein is muted, it is going to be accumulated in our body, which is called transthyrein amyloidosis. Then after that, we have the dialysis related amyloidosis. So basically, what is the meaning of dialysis related amyloidosis? It's mean it is a condition which develop in the patients of CKD, chronic kidney disease, or in those patients who has end stage renal disease. And we know that those patients who have CKD or end stage renal disease, those patients are going to be on dialysis. So when you are going to get a dialysis, after dialysis, there is a one protein which is going to produce in your body, that is beta 2 microglobulin. So this beta 2 microglobulin is only produced if you are having the like dialysis, or if you are on the long term dialysis. So this is the abnormal protein, beta 2 microglobulin. So this is abnormal protein, and that protein is going to be deposited in our tissue, in our extracellular space. So the protein which is going to be accumulated in the CKD patient, or in those patients who are on the long term dialysis, that protein is beta 2 microglobulin, and that protein is mainly because of dialysis. That's why it is called dialysis related amyloidosis. So these are the, you can say, different types of systemic. Now let's discuss the localized amyloidosis. So just 1 minute. So let's discuss the you amyloid plaques. And these amyloid plaques are going to be deposited in extracellular space. So they can ask from you in the exam, in the Alzheimer disease, from where this beta amyloid protein is produced. It is going to produce from amyloid precursor protein. So this is the definition of Alzheimer disease, you can say related amyloidosis. Then after that, please keep one thing in mind the this beta amyloid precursor protein is like you can say uh, the protein which is going to be produced in Alzheimer disease, that the gene is present on the chromosome 21. They can ask from you in the exam, like on which chromosome it is present. It is on the 21. On the 21 we have the, you can say, the beta amyloid precursor protein 21. So these are the important things which you have to keep in mind. Then after that we have the isolated atrial amyloidosis. So what is the meaning of this condition? So basically it is also the condition which is associated with aging. As your age is going to increase, and when it go and deposit in your tissue, it will lead to a damage of your heart. Let's suppose if it is going to damage in the heart atrium, it will lead to atrial fibrillation. So they can ask from you in exam, like in the case of localized amyloidosis, if the abnormal ANP protein is going to be deposited in the atria, what is a complication that a person can develop? That is the atrial fibrillation. Then after that, we have the type 2 diabetes mellitus. In the type 2 diabetes mellitus, again, there is a production of protein which is called islet amyloid polypeptide. This is the amyloid protein which is going to produce in type 2 diabetes. And how it is going to be produced? Basically, it is caused by the deposition of amylin in pancreatic islets. So it's mean when there is a deposition of amylin in the pancreatic islets, the pancreatic islets are going to produce the islet amyloid polypeptide. And this amyloid polypeptide is physiological mechanism or in the pathological. So you guys have to keep in mind, can be produced physiologically. Phosphorylation, we know that over cytochrome C oxidate, that transfer the electron to, normally the oxygen is going to accept the 4 electron. If you give the 4 electron to oxygen, it will convert into water. And if oxygen will receive the 4 electron, it is not going to produce the free radicals. I will again highlight and revise this point. Please keep this point is very very important. Normally, if you are going to give 4 electron to oxygen, it is going to convert it into water. It is not going to produce any free radical. But when the oxygen didn't receive the complete electrons, like if the oxygen will not receive the 4 electron, it is not going to produce, it is not going to convert it into water. So then what are the free radicals that are produced when the oxygen is partially reduced? Partially reduced means oxygen is not going to receive the 4 electron. So let's suppose if I give oxygen only 1 electron. Let's suppose if I give the 1 electron to oxygen, it will become O2 negative. Then after that, if I give 2 electron, it will become H2O2. Then after that, if I give 3 electron, it will become OH. And if I give 4 electron, it will become H2O. So it's mean if you give oxygen 4 electron, it will convert into water, and it is not the free radical. But what happen if you give 1, 2, or 3 electron to oxygen? So if you give 1 electron, it will become O2, superoxide. Then if you give 2 electron, it will become hydrogen peroxide. Then what happen if you give 3 electron? It will become hydroxyl. OH mean hydroxyl. So these are the free radicals which are produced from the oxygen. So these are the physiological free radicals that are going to produce during the oxidative phosphorylation. Then also there are the example of pathological free radical production. Like what are the example in which the free radicals are going to be produced pathologically? So first of all, you can take the example of ionizing radiation. Ionizing radiation. Then after that, if you take the example of inflammation, inflammation also the free radicals are produced pathologically. Then also there are some kind of metals like copper and iron. Copper and iron are also going to produce the free radical in pathological mechanism. Then also we have certain drugs, like the person is using the acetaminophen. Acetaminophen is going to produce the pathological free radicals. You have to keep this in mind. So these are the examples of physiological and pathological. First of all, what is the normal definition free radical. Free radical, these are the chemical species orbit. So definition of physiological and pathological. What are the example of physiological? Physiological can be produced during the oxidative phosphorylation when the oxygen is not getting the 4 electron. If you give oxygen 1 electron, it will become O2. If you give 2 electron, it will become H2O2. If you give 3 electron, it will become OH negative hydroxyl group. Then after that, if you give 4 electron, it will become water. So these are the physiological examples. Then after that, the free radical can also be produced pathologically. Then what are the example of pathological free radical production? So in the case of ionizing radiation, in case of if in your body there is a combination of iron copper, these iron and copper by the membrane lipid peroxidation, protein modification, DNA breakage. So what is the meaning of this line? So first of all, try to understand how the free radical are going to produce. So they say when the free radical are produced, they are going to damage our cell membrane. Free radicals can damage our cell membrane with the help of lipid peroxidation. Then these free radicals are also going to damage the DNA with the help of oxidation. They're also going to damage the protein with the help of oxidation. So the free radical damage can lead to peroxidation also in case of redox reaction, then also from the inflammation. In the inflammation, there is nitric oxide is going to produce, and that nitric oxide is producing the free radical. Then also iron, copper, these are also the example of metals, and these are going to produce the free radical. And how they are going to produce the free radical? With the help of Fenton reaction. They can ask you in this the copper and the iron are going to produce the free radical. That is the Fenton reaction. Then after that, we have the example of white blood cell. The white blood cell are also going to produce the free radical with the help of neutrophil of reactive oxygen species occur, and these reactive oxygen species are also the example of free radical. So these are the mechanisms through which you are going to produce the free radical. Then after that, he said when the free radicals are going to produce in our body there are different kind of mechanism through which we can eliminate this free radical. Like we have the catalase enzyme, we have the superoxide dismutase enzyme, we have the glutathione peroxidase. Then there is also the spontaneous decay. These free radicals are automatically going to decay. Then also we have the antioxidant vitamin A, C, and E. These are the antioxidant which will go and destroy the free radical. Then also in our body there are certain proteins like transferrin and seroplasmin. These proteins which these protein will carry the metals like transferrin is going to handle the iron free radical. Then they can also ask in the exam, please give the example of enzyme which is going to produce the superoxide, because superoxide is a free radical. So I am going to again draw that equation. This is the oxygen. If you give 1 electron, it will become O2 negative superoxide. And if you give 2 electron, it will become H2O2 hydrogen peroxide. And if you give 3 electron, it will become hydroxyl. And after the 3, if you give 4, it will become water. So first of all, this is the first free radical, this is the second free radical, and hydroxyl is the third free radical. How our body is going to eliminate this free radical? In our body, there are different kind of enzymes. Like we have superoxide dismutase. This enzyme is going to eliminate the superoxide. Then we have the catalase, break down the H2O2. Then after that, we have the glutathione like glutathione, superoxide. They didn't mention anything about their function. So that's why it's very important to note these things in your book. Then after that, they give the examples in which the free radicals are going to produce. Like if the oxygen is going to be accumulated in your body, if in your body there is toxicity of oxygen, it will lead to the retinopathy of prematurity. Like, what is the meaning of retinopathy of prematurity? You know that when the baby is going to produce premature, that